Two young Pacific researchers have teamed up with the South Auckland community to take on rheumatic fever and gout, which are two of the major health issues facing Māori and Pacific people. Postdoctoral research fellows Dr. Siobhan Tuakoi and Dr. Samuela Ofanoa launched their respective research projects this year, funded by the Health Research Council. They named rheumatic fever and gout as largely affecting Māori and Pacific people in their communities. However, Dr. Nigel Wilson of Starship Children's Hospital has worked on the front line as a paediatric cardiologist for more than 30 years, and he says the rates are much higher in the Pacific region. Dr. Wilson spoke with RNZ Pacific reporter Grace Fiavai.
Rheumatic fever is a childhood infection which affects your ankles and your elbows and your knees, and it's very painful, but that all goes away. But what persists is a persistent inflammation of the heart, leads to heart valve scarring and long-term damage to the heart. So it's a very, it's just a difficult message that why could a sore throat affect your heart? And that is the message to get across.
What are the rates like in Aotearoa when it comes to ethnic disparities?
Unfortunately, rheumatic fever remains an unsolved problem in Aotearoa, New Zealand. Currently, the rates are twice as high for Pacific children as Maori, but we really only have one or so European child getting new rheumatic fever currently. So there's a huge ethnic disparities. We do know that Pākehā used to get rheumatic fever, and we have a registry of long-term rheumatic heart disease. So rheumatic fever is determined by socioeconomic determinants of health. So those with more crowded housing are more at risk of getting rheumatic fever. Pacific particularly have multi-generational living, culturally appropriate, and the houses are not big enough, and there aren't enough houses. So the overall fleets of houses, the stock there is too small for the country. A slow solution. In terms of the community level, it's important that children get this. If they have a sore throat, that they get to see a nurse or a doctor to do a throat swab and to see if it is the strep. And if it is strep, then to have 10 days of oral antibiotics. And there's a lot of barriers in the health services to actually getting that done, because you've got to take time off work, take the child to get a test, wait for the result and start the antibiotics. And there's a lot of work going on at the community level to make this, to make it more easy for Māori and Pacific to get their sore throats treated, assessed and treated correctly.
Is there a significance in rates compared to New Zealand then in the Pacific? And what are the causes of it? Did it used to be like this, just, Pacific Islanders and Māori?
In my department, in Starship Children's Heart Department at the hospital, we go out to all the South Pacific Islands and do clinics with the paediatricians, and we see rates of established bad rheumatic heart disease amongst children, and they're high, if not higher, than Pacific children in Aotearoa. So it's a huge problem in the Pacific, and it's a huge problem internationally, rheumatic fever still.
So what should we keep doing to get better outcomes?
The more we keep it in the forefront, the more we've got a chance of preventing and getting better outcomes overall for those that are affected.